With BSc in Nursing from AFMC and MSc in Medical Surgical from Leelabai Thackeray College of Nursing, she completed the 3rd Advanced Nursing Care Administration and Quality Management course in 2020. Throughout her career, she held key positions such as Principal at Army College of Nursing, M.H. Jalandhar, Kant, and Vice Principal of College of Nursing, Command Hospital, Central Command, Lucknow. Her accolades include GOCNC Western Command Commendation in 2014, and Nightingale Award from the National Press Council of India in 2019. She also contributes to numerous national and international continuing nursing education program and workshops. Let's give her a warm welcome with a big round of applause.
Thank you. Good morning, ma'am, and a very good morning to Brigadier Geeta, the principal of College of Nursing, FMC Pune, and her faculty, senior members, my juniors, and dear students, my colleagues, and the civil counterparts. A very good morning. Since the MC has already introduced the speakers, I will not waste much time. Artificial intelligence in nursing is revolutionizing healthcare by enhancing patient care, optimizing workflows, and improving outcomes. This presentation will explore the potential of AI in nursing and its impact on the healthcare industry. Now we have the first speaker, Colonel Jesse Matthew, Principal College of Nursing, Air Force, Bangalore. Colonel Jesse Matthew acquired her master's in R.A.K. College, New Delhi. She completed a post-graduation in clinical research at Symbiosis, Pune. Served in various clinical, teaching, and administrative appointments. To name a few, she served as wing matron at Chandigarh, and she also JDMNS headquarters, Western Command, Chandigarh. She was detailed as examiner and paper setter in MUHS, Rajiv Gandhi University of Health Sciences, and various other universities. Awarded Chief of Army Staff Commendation in the year 1995. She also was awarded GOCNC Commendation in Eastern Command in the year 2012. Now I invite Colonel Jesse Matthew on the stage.
Thank you, Chairperson, for the kind introduction. It's always a pleasure to be here at FMC amidst my teachers, my mentors, and it gives me a nostalgic feeling. And I feel humbled and privileged to be a part of this CNE. A very good morning to ladies and gentlemen. At the outset, I would like to extend my heartfelt gratitude to the organizers for inviting me for this session of CNE to present my views on the topic, current insight and interpretation of worldwide application in nursing. Artificial intelligence is not a substitute for human intelligence. It's a tool to amplify human creativity and ingenuity. I unquote Fifi Lee, a China-born American computer scientist. Now, I would like to draw your attention to this picture. What do you see in this picture? I'm sure you will agree with me. There is a soldier in military uniform with a backpack and a smile on his face. And he is outside the airport area. Probably he is returning home after his military assignment. I say airport because I can see on the background there is a security fencing. And he is loving his pet dog. It takes a couple of minutes for a human being to interpret this data because the human brain has the ability to filter out what is not relevant and to learn from what is relevant. Now imagine if this has to be done by a machine. The machine will look for the background, the color, the shade, etc. That's a difference between a human brain and the machine. So the key point here is learn. Now, the human have the ability to learn. Now, the mankind is trying to make the machines learn. Therefore, this brought to the current insight of artificial intelligence. Now, let's see what is artificial intelligence in simple terms. It's a simulation of human intelligence by machines, especially a computer system. According to technology writer Sarah Castellanos, artificial intelligence encompasses the technique used to teach computers to learn, to reason, perceive, infer, communicate, and make decisions similar to or better than humans. Now, how does AI work? It works by ingesting a large amount of data. It analyzes the data for correlations and patterns using these patterns to make predictions, that is the algorithm. They are the building blocks of artificial intelligence. Now, the key point to know is we have data. The machine learns from the data and make predictions as algorithms. Now, let's look into the history of evolution of artificial intelligence. When I was reading about the history of artificial intelligence, I was astonished to know that it dates back to as early as 1642 as a mechanical calculating machine which was developed by a French mathematician. Now, when you look into the hype cycle of artificial intelligence, you know that it has three phases: the phase 1, phase 2, and phase 3. In the phase 1, there was a technology trigger. I went into curiosity and excitement, and later there was a peak of inflated expectations. But in phase 2, there was a despair, because of lack of funding and lack of research in the AI. It went into a trough of disillusionment known as AI winter. And later there was a slope of enlightenment, and then we came to phase 3. It developed, picked up momentum and developed confidence. And there is a plateau of profitability, and it continues, grows further. John McCarthy, an American computer scientist, he coined the term artificial intelligence in 1955, and he is known as the father of artificial intelligence. Now, let's look into the important terminologies that we learn in artificial intelligence. They are NLP, or natural language processing, ML, or machine learning, DL, or deep learning. And natural language processing is a branch of AI, focuses on teaching the machine to understand, interpret, and generate the human language. Whereas machine learning is a subset of AI. It involves the systems that learn by themselves. The system can intelligently learn by its own. The third, we have deep learning. It's a subset of machine learning. It uses various models which are built upon deep neural networks to detect the patterns with minimal human involvement. We have, as the mathematical instructions like algorithms. They are called as the nodes. It is similar to the neurons of our brain, and there are billions of nodes which are embedded in many layers. Now, let's learn what are the three types of intelligence. They are artificial narrow intelligence, or ANI, artificial general intelligence, or AGI, and artificial super intelligence, or ASI. In artificial narrow intelligence, in stage 1, there is machine learning. The machine can learn only one task or a particular problem. The examples are, Siri, Alexa, and Cortana. We have already conquered this level, and we have already stepped into AGI, that is artificial general intelligence. In this stage, there is machine intelligence. Now, it refers to here the computer act as smart as a human brain. And the third, the artificial super intelligence, here the machine has consciousness. It is much smarter than that of a best human brains. We have yet to conquer this. Now, with this background, let's see how AI is impacting our lives, from smartphones to smart homes. Today, a toddler can operate a smartphone. He knows what to search. The CCTV, what we use in security and surveillances, the various social media platforms, like Instagram, Facebook. the Google map that we use for navigation, and the shopping apps like Amazon, Flipkart in e-commerce, and the banking UPIs, the Google Pay, etc. we use in the banking and finance sector, and the autonomous vehicle, like Tesla, which are developed to reduce the accidents due to the human error, and also the smart home where we can remotely sit and control all the systems of our home within the click of a button. You can switch off the light, switch off the fan, open the door, close, etc. Now, with this background, let's see what's the role of AI in healthcare. What is the healthcare aims at? It aims at best care. Now, the scope of AI in healthcare starts with early detection of ailments. It improves the decision-making power of the doctors, the nurses, and the other paramedicals. It also helps in treatment. It gives you the best treatment options. It also helps in expanded access to the other medical services. It also helps in the associated care, the other field, other specialties, other streams. And with all this, it is giving you a superior experience. We also have various, health. We can also check the health through various wearables which are available to us. And with the help of artificial technology, we can also mitigate the sufferings and also improve the quality of life of end-of-life care. Now, let's see in the current scenario, how AI is impacting the healthcare. We have smart operating rooms. We have AI-assisted robotic surgeries, which are conducted in various specialties like neuro, it's done in obstetrics, it's done in orthopedics. And there are various, hospitals which conduct these, robotic surgeries in India, including the R&R hospital in Delhi. Now, let's come to the topic of application of AI in nursing. The artificial technology has revolutionized the nursing practice, and I will be talking on the 4 main headings. That is the nursing practice, nursing administration, nursing education, and nursing research. Now, let's see the application of AI in nursing practice. It helps in clinical decision support, predictive analytics, remote patient monitoring, patient care assistance, workflow optimization, and medication management. Let's see one by one. The AI data, the AI can analyze the data and helps in the diagnosis and helps in the treatment, the prognosis. It also can predict the deterioration of patient's conditions based on the vital parameters and the other medical data. For example, a patient who is admitted in the ICCU ward, the patient developed arrhythmia. The AI technology detect ventricular fibrillation and it gives you the best treatment option, fibrillate, and therefore we can manage the case. In predictive analysis, the AI technology can predict based on the algorithms, the risk of patients. For example, a patient who is admitted in an acute care setting, an elderly patient, the patient is at risk for fall. The system says the risk for fall. The nurse can take proactive measures by providing a rail bed to the patient, to give a call bell, and also provide with other assistive devices. It also helps in remote patient monitoring. With the AI technology, with the monitoring devices and also other wearable sensors, we can monitor the vital signs and other health metrics of the patients. The nurses also can receive alert if there is any, abnormal finding in the patient. For example, a patient admitted in the neuro ward as a case of head injury for observation, and the patient developed, bradycardia and hypertension, the signs of increased intracranial pressure. The system gives the notification. Therefore, the nurse can get alerted and we take the measures subsequently. The AI technology also helps the patient care assistants like AI chatbots and virtual assistants. It also helps in instant response to the common queries that we ask. It can collect the patient information. It can also engage the patient in effective communication. It can also schedule the appointments. It also collect feedback from patients. It also helps the nurse in streamlining her task with the automated routine tasks, the documentation, scheduling of appointments, the inventory management. Most of the